Friends, do you think a panoramic x-ray is enough to diagnose the placement of an implant? I want you to see this. We've had several patients come in with these types of treatment plans, where with a panoramic x-ray, they're told they're going to get 6 implants, 4 implants. They draw them on with a marker, and that's it. And they tell them, oh, you have very good bone. We can perfectly place your implants. They come to us and say, hey, doctor, they tell me I have very good bone. Why are you telling me the opposite? I'm going to show you why it's so important to do a tomography and why these panoramic x-rays are useless for diagnosing for an implant. Let's take a look. Friends, the patient you just saw in the panoramic x-ray where they could supposedly place 6 implants on the upper part is actually like this. This is the current state of her bone. If I do a tomography and see the thickness of her bone, just look, it seemed to have very good height. However, the tomography is 3-dimensional. Therefore, if I look at it 3-dimensionally, we see that we have a very thin lamina of bone, or you can barely see any bone. If I were to place an implant in this patient, it would be completely exposed. You can see how there'll be a lack of bone here, and on the inside as well. What does that mean? If this patient had been operated on using only this panoramic x-ray, they would have encountered a very unpleasant situation. The patient would already be completely opened up, already in surgery, and unfortunately, they wouldn't have been able to place a single one of her implants. And not only that, they would have run into the huge problem of having to place a bone graft in the entire maxilla. Therefore, imagine arriving nervous for a surgery where they told you that you had no bone problems, because on top of that, obviously they told her she didn't need a bone graft, that she had very good bone, based on how it looked in the panoramic x-ray. You arrive for the surgery, they operate, they sedate you, because this surgery is done with sedation. You wake up from the surgery and they tell you, oh, guess what, ma'am? Nothing could be done because you didn't have any bone. And at that point, who knows what excuse they'll give you. But in reality, what happened is that there was no planning. So this software that we have, thanks to the tomography, allows us to see the thickness of the bone and calculate more or less if an implant will fit or not. For example, in this case, we are seeing a sagittal cut here, which means you cut the patient at this angle. And you can see here perfectly that there is not enough bone. For example, look at this sagittal cut. Look how long it looks from here to here. But if I want to place an implant right now, you'll notice how it lacks a lot of thickness. This software allows me to place the implant I want with the length and thickness that I want. This implant is very thin, 3.75 millimeters. Any thinner and it would be very difficult to restore a mouth. Notice how there's extra implant here and extra implant over here. So even though the bone is long, it's not wide. And what the tomography allows us to see is the width and of course the length of the bone as well. Therefore, it's very simple. If you want to have a planned surgery with predictability, you have to get a tomography scan. Another very important point about tomography is that it lets us see the bone density. What does this mean? If I'm looking to see what quality of bone the patient will have, the best thing is a tomography scan. Because even though I can see that there's very good bone, seeing it is not the same as actually knowing what type of density it is. And this is a very simple tool that tells us how much bone density there is and how far we can place the implant. Therefore, if it tells us it's a density of 4 or 5, obviously, even if there is bone, that implant cannot bear any load. Something very important that tomography allows us to see are anatomical structures that are critical, such as, for example, the inferior alveolar nerve. This nerve is practically responsible for the sensation in half of our mouth. Imagine that I place an implant and I hit that nerve. Well, it's more common than you might think. And why? Because seeing it on a tomography scan is not the same as seeing it on a panoramic x-ray. Let me explain. Here we are seeing the implant where we want to place it, and I can mark the alveolar nerve. So that if I look at it in a 3D structure, I can see perfectly where the implant I want to place is and the nerve and how far away I am. This easily indicates to me that I can place a longer implant without any problem. If we don't have this technology, imagine how complicated it is. I'll give you an analogy. It's like trying to navigate from America to Europe with a compass when we have a GPS on our cell phone. That's how drastic the difference is between using a panoramic x-ray instead of a tomography scan. Friends, therefore, if you know someone who is going to get an implant, or if you are, make sure that they first perform a tomography scan and give you a good digital diagnosis so that the surgery is very predictable and a complete success. If you like this video, give it a like and subscribe to the channel. It's free and it's very valuable information for your oral health. Remember, you can also find us on Instagram at Dr. Federico Baena, and we'll see you in the next video. Take care.